Hello, guys. I am back to review chapter 11. We're going to talk about the throat and the thorax. Okay, we're just going to hop right into it. Okay, you have two major sources of blood supply, which is your carotid arteries and your jugular veins. Of course, puncture or rupture to any of these will offers the potential of the person bleeding to death, which is why it's so important to have the proper equipment to protect your throat. To protect these arteries. Okay, we talked about a little bit more in depth about the throat, about the functions of the esophagus, the trachea, and the larynx. And as I mentioned before, the carotid artery and the jugular vein are critical sources of blood supply for the body and for the brain. So it's very important to protect these as far as an athlete is concerned. Okay. You do have 12 pairs of ribs. I believe I may have mentioned that in an error. I don't remember if I did. Probably because I'm still trying to catch my footing with these hybrid classes and online teaching. So, yeah, still a little chaotic for me on my end. But if I did not mention it, you have 12 pairs of ribs. You have 10 true ribs and two floating ribs, which are the lower ribs, and they are connected to the sternum. Okay, so one of the questions here is as far as what do the ribs or what do the ribs protect as far as the processes are concerned. I will say for the organs, it protects the heart, okay, your lungs, and your diaphragm. All right. So I mentioned a little bit with the processes. Okay, starting from the diaphragm. Now you have exhalation and inhalation, which is the mechanical process of breathing. Okay. Now, breathing does contain your lungs as well as your nose, anything that's used in terms of getting airflow in and out. Now, as far as your lungs, but also can occur throughout the body, the process of respiration does happen. But it's a little bit of a cellular exchange, just an exchange of gas within the cells of the body. But of course, respiration is critical for air supply. But we'll just go ahead and just connect lungs because, of course, you have a million cells in your lungs, and it's so important to keep that function going. So that's some of the processes, and of course, protecting the heart and circulation. So, of course, any blow or any injury to the heart can stop circulation immediately. And of course, at that point, there's sudden cardiac death, or sudden death rather, as a result of loss of circulation. So that's what's pretty much it as far as that. Um, Now, in talking about protective equipment, okay, it's so important to utilize and make sure it properly fits your throat and your chest protectors, as well as your shoulder pads, because oftentimes shoulder pads they do protect the sternum as well. So as well as the clavicle. Even though that's not really too built into the thorax, but with it being very close to the ribs and the sternum, we could include that in there. We could. But of course, we know that our clavicle is a little bit is more affiliated with the shoulder, and we'll just leave it at that. But as I said, you want to make sure it properly fits to make sure that the athlete is not in danger of any sort. Of course, any type of throat laceration, of course, with it being a kind of a cut to the throat. If it's superficial or closer to the surface of their skin, it does either way. It does require medical attention, but superficial, as we know, superficial means a little bit closer to the skin or closer to the skin. Of course, we can do something treatment until the activation of EMS or 911 comes. But however, if it's deep, there runs a risk of air embolism, which means that there are pockets of air, outside air, that has entered the body, which is extremely dangerous. So we want to make sure that we prevent that. And of course, with treatment, it says to lay the athlete closest to the ground and apply direct pressure. And of course, you do need to activate EMS immediately in the case of that. So either way, it is is a medical emergency, but just be mindful that superficial and the difference between superficial and deep being we're in not deep trouble, but of course it is a little deeper than what we expect. And just be mindful that your athlete might go into shock. So effective treatment for that is critical. Um, you can damage the cartilage. So it basically you're just damaging or placing a lot of pressure on the rings of the trachea, which could cause your athlete to have some trouble breathing. And as a result, when there's trouble breathing, your athlete might go into an anxiety attack. So, key thing you want to do is you want to keep the athlete calm, call 911, or wait until the MD comes on the field to be able to treat a cartilage fracture. Hyperventilation is quick breaths. Same thing, keep the athlete calm, help them to control their breathing. Oftentimes as a result of hyperventilation, there might be numbness in the hands, loss of consciousness. The athlete might appear flushed, there's lightheadedness. So again, while the athlete is conscious and there's hyperventilation, you might want to help the athlete to be calm and help them to calm down, but still call the medical physician or the medical doctor or the nurse practitioner for further analysis. All right, so exercise-induced asthma, you want to ensure that your athlete or your fitness client or your patient has been properly diagnosed with exercise-induced asthma. Do not give them an inhaler just from any random location, please do not, or yours. But now, within the last 10 years, exercise induced asthma has been more common than what it was before. So, at that point, this is where a pre participation physical is critical because that is something that some athletes may not always mention. Contusions. Let me make sure I'm still on these notes. Contusions, a blow to the solar plexus, which is, in a nutshell, to explain very lightly and very loosely, it is essentially a network of nerves. Any injury to that is pretty serious, and generally it's very close to the diaphragm. So you want to keep that athlete calm. Okay. Any of the contusions are here either way, a pulmonary or myocardial. They both are critical to the point where you do need to call 911. And with the rib contusion, you want to check for any fractures, and you can just simply apply ice. And of course, you want to refer them to a MD if necessary. So like most bones, or like any bone or every bone, fractures can occur. You be careful with a fractured rib because there runs a risk of a punctured lung. So, it says, for all of them to refer to the hospital as soon as possible. I agree. You want to get them to the hospital as soon as possible with any type of fracture to the sternum or to the rib or ribs. Okay, you have pneumothorax and hemothorax. Okay, now we talked about it in class that hemo, because this will come back eventually. Hemo means, did not mean to do that. Let's change the color. Hemo means blood. Okay, since I can't highlight it, but just know that HEMO or HEMA indicates blood, and of course, thorax being in the chest. And pneumo being more so air flow, air sac, breathing way. We think of pneumonia. So that's what we think of when we think of the prefix pneumo. So anytime you see this prefix, just know it is something that is related to the lungs or something that's related to breathing, and this being related to blood. Either way, 911 needs to be called for any of the two. So especially hemothorax, because the last thing you want to do is to allow blood to fill the chest cavity, because then you will have to start chest compressions. And Not going too deep into the dorsal aortic rupture and the cardiac tamponade. And the reason why I don't want to get too deep into it because I have not had too many experiences or have not come across any incidents of such. But just know that a cardiac tamponade that can stop the heart. It is just a direct blow right into the chest. And it can, and the sac that surrounds the heart can be filled with blood, and that is extremely dangerous for both situations. You do need to get to EMS pretty quickly. And with dorsal aortic rupture, the reason why it says do not move the athlete because we've mentioned before that the going back as I use this. Okay, we talked about the kind of the within this region, your carotid artery and your jugular veins. Those tend to be major veins that carry a lot of blood, especially your aorta. You want to avoid excessive movement because excessive movement can cause the athlete to bleed to death. So that's pretty much it. So, long story short, make sure your athlete is wearing the proper throat and thorax equipment. Talk soon.